I've run 13 marathons. Every time after you finish, you think, oh, I'm not going to do that again. That was so much work. I'm so exhausted. And then a couple weeks go by and you start thinking, I need to have a goal again. So it's addictive, really. It makes me feel physically good, mentally good, and it's just always been my passion. I sort of had in my head that I wanted to run the 2015 Boston Marathon. About 2 months later, I found a lump in my breast and ended up having a biopsy, coming back as breast cancer. And I had a postcard up on my fridge that said, you've been accepted into the 2015 Boston Marathon, and I was not going to let this cancer not let me run. It definitely seemed much more feasible in November when I first found out what they thought was going on, but by the time January came and the surgery was a mastectomy as opposed to a lumpectomy, the treatment was chemotherapy as opposed to radiation, all of a sudden it sort of seemed, is this going to be possible? A few days later, I got a phone call from the oncologist, and he said, there's a clinical trial going on with Dr. Lisa Carey, and I think you're eligible, and I think you should really consider it.
So the chemotherapy gets delivered into the cancer cell, and presumably not much elsewhere. It does mean that people typically keep their hair. They have fewer of the traditional chemotherapy side effects. And in someone like Amy, it means you can keep running marathons.
I did the first treatment, felt fine, had the second treatment, and now it's sort of decision-making time. And I looked at my husband and I said, you can't finish if you don't start. So the whole family, we bought 5 tickets, and then I was committed. I'm running this marathon. I was sort of all of a sudden transformed back to marathon running Amy. It was more about getting to the finish line than it was about what's my time gonna be. It was 4 hours and 5 minutes. I crossed the finish line, put my hands up, and just sort of knew in my own head, you've been through a rough 6 months and you did this. That night I had all these emails from all these different people. One of them was from Dr. G's, who had said, I can't believe Amy ran the marathon on active treatment. I followed you all day. I'm so impressed. I've been really lucky that Lineberger has this clinical trial to offer someone in my situation.
Not all of my patients are running marathons, but she's been able to really keep up with her life and keep it as normal as possible.
Personalized care is allowing us to make inroads for each individual patient. We're really bringing brilliant basic science minds and the humanity of care for patients together.
It allows people to not be defined by their cancer, to keep living their lives. You just can't take a year off from life or 6 months off from life. You need to keep going during that period.
My name is Rengate Austin. I'm a Mason at UNC Chapel Hill. I've worked over here for 15 years. I love my job. I just got a passion for doing what I do. It's just making things, beautifying things, making things better for the campus. So it don't fall down. Just keep repairing it so it, it'll be here for years to come. It was pretty rough. That chemo and it knocked 40-some pounds off of me. And it was a lot of sleepless nights. When I first found out about the lung, that's when Dr. Rice told me there's no cure. But he said he could treat it. I said, well, treat it. When he choosing the medicine for me, he would say, if this was my mom, that's what I would recommend. And that made me feel like I'm somebody. Nobody wants to stay at the hospital, but I enjoy it. I couldn't even tell I was at the hospital. The care I received, it makes me wonder if everybody gets the same kind I do. As much as I care for this university, they care for me. And it's a wonderful place to work, a wonderful facility, the hospital, the cancer center, and all. I mean, thank God for it. It's been a journey. I mean, why worry about something you don't have no control of? Tomorrow is not promised to no one, nobody, regardless of what your health is. So I feel like I got as much chance of living as anyone else. I just keep living every day, day by day.
You know, making sure that the discoveries get to the patients is a really important part of any cancer center mission, and clearly something that we take very seriously at the Lineberger.
Cancers can have different Achilles heels. You know, once you understand more about the cancer, you want to try and tailor your treatment. That's the promise of personalized medicine.
We are going to see 4,500 new patients this year. Each one of them is an individual. If we can change the lives of 10% of those people, in addition to what we were doing, what could be better?
We started our family back in 2001 with our daughter Fiona. 3 years later, we had another daughter, and we were done, 2 kids. When our youngest daughter was 16 months old, they looked at her and said, "Hey, there's this rash." It turned out she had leukemia.
You know, one of the arguably hardest conversations I've ever sat through was the "we're out of options" conversation with my daughter. So this was the take her home and help her die conversation.
Her disease was too aggressive, and we lost her in December of 2006. Our son, Phineas, was born in 2008. And he loves Legos.
Crazy into Legos.
Loves to build things, take
Loves
things
to
apart,
disassemble things.
make messes faster than I can clean them up.
He is a combination of, I guess, Calvin from Calvin and Hobbes, Dennis the Menace, and Bam Bam.
He's all boy.
All boy.
After having 2 girls, he was a real shock.
Yes.
When he turned 4 years old, took him to the pediatrician, and this doctor was checking him out and looked at his chest and said, "Oh, he looks like he has a rash." I knew right away when I saw that. Diagnosis number 2, leukemia. A couple months into his treatment, we found out that it was not responding to the standard course of treatment. We had to find something else, or things were not going to go very well.
That's where we first met Dr. Ayers. He was very knowledgeable, and from the get-go that gave me a higher level of confidence.
Because of our experience losing our daughter, we discussed with Dr. Ayers about getting into a T-cell therapy trial.
Everybody with a kid with leukemia wanted their child in one of these trials. Dr. Ayers persisted, and
within a week,
we
were literally on a conference call with the main doctor at NIH.
Yeah.
Immuno-oncology is the idea of using the patient's own immune system to fight the cancer. His own T cells are harvested, they're expanded outside the body, and then given back to the patient, and he promptly went into remission.
Within 28 days of giving him these modified T cells, his cancer was gone. It was gone.
In 6 months, he's rocking amusement parks under his own power.
This is big. It's like science fiction, but it's not fiction. It's real, and it saved our son.
Based on stories like Phineas's and other patients, we decided we had to develop this capability here, and we were able to build a facility that will allow us to offer this therapy to patients who need it.
We've recruited 2 of the best people in the country. We have faculty here that are ready to go. This is going to be an exploration over the next decade of curing people that you can't cure.